Welcome back, students. This is the time to dissect the rectus abdominis muscle. Rectus abdominis muscle is a vertical muscle. We have seen the other three muscles of the anterior abdominal wall, which were the flat muscle. Now this rectus abdominis muscle is present on either side of the linea alba in the median plane, on either side of the median plane. Okay, there are actually two vertical muscles. One is the rectus abdominis and another is a very small pyramidalis muscle, which is sometimes absent also. Now this rectus abdominis muscle extends from the pubic symphysis down below here up to that of the gypite process and the costal cartilage, up to the level of the gypite process. Okay, we will dissect this rectus abdominis muscle onto the left side. Okay, so we will just dissect it onto the left side. Now this is the rectus abdominis muscle, which is enclosed within the aponeurotic tendinous aponeurosis of the three muscles, that is external oblique abdominis, then the internal oblique abdominis and transversus. Their aponeurosis of insertion, they split and enclose this vertical muscle which extend in the on either side of the median plane. So this is that rectus sheath. Okay, and within this rectus sheath we will get the abdominis muscle, rectus abdominis, and as we know that this sheath is formed by the aponeurotic tendons of this muscle. So what I am going to do is that just I am trying to feel this pubic tubercle here, okay, and then from the pubic symphysis I will give a vertical incision in this rectus sheath, that is into the aponeurosis of the external oblique abdominis, and will reflect this rectus, this aponeurosis on either side. Okay, so I am giving this vertical incision here. See this is that vertical incision I have given, and deep to it we will get the muscle, that is the rectus abdominis muscle. Okay, so I am reflecting this sheath which is attached to this, okay, rectus abdominis muscle. There are three tendinous intersections which just run from the anterior aspect of this rectus abdominis muscle, and these three tendinous intersections, they just divide the muscle into four muscular bellies. Okay, and this tendinous intersection, they are attached to this aponeurosis, that is to the anterior margin of the anterior surface, not margin, anterior surface. They come from the anterior surface of the rectus abdominis muscle, and they are present here, getting attachment onto the undersurface of this layer of the rectus, this rectus sheath. See, I am trying to just reflect this anterior layer of the rectus sheath, because this muscle, the rectus abdominis, is enclosed both on its anterior surface as well as on posterior surface by this rectus sheath. Okay, so this is the tendinous intersection which is at the level of the umbilicus. So these fibers are just adhering to that of the anterior layer of the rectus sheath. So I will just cut these intersections, and as I said, there are three intersections present in this muscle. One is at the level of the gypite process. Second is at the level of the umbilicus. This is the umbilicus. And the third is in between the two, that is between the gypite and to the umbilical level. Okay. I got the small pyramidal shape pyramidalis muscle just at the lowest part of this rectus sheath. I will clean it and will show you. Yes, this is small pyramidalis muscle whose base is attached to the pubic symphysis, anterior aspect, and to the pubic bone, and tendinous apex is going and getting attachment to the linea alba. So this is that small pyramidalis muscle. Just I will cut this part of the rectus sheath so as you can see that pyramidalis muscle going and getting attachment onto the linea alba. So this small muscle here, I hope that you are seeing, very small pyramidalis muscle base, and the rest of the muscle is the rectus muscle. It is the rectus abdominis muscle. Okay, let me clean this and separate it. This is okay till separation is easy till the umbilicus, but after the umbilicus this muscle is, as I said, is attached by tendinous intersection here. So I will have to cut this tendinous intersection which are going and getting attachment to the, rectus sheath anterior layer. See, these fibers are attached firmly. From one tendinous intersection they are going to that of the other tendinous intersection. The second tendinous intersection here, it is here at this level. This is, and it is firmly attached here. So almost the complete rectus abdominis muscle I have exposed it here. This is a muscle which is a vertical muscle. Fibers are running vertically from G.P process and costal cartilage up to fifth costal cartilage and going right up to the pubic symphysis. Okay, let me clean it here. This muscle spreads up, widens as it goes from pubic symphysis below where it is quite narrow, but as it goes towards the costal cartilages in the thorax, it becomes quite wide. So I will try to remove this muscle, its medial margin which is at the linea alba in the midline. Very close to the midline is the medial margin, and lateral margin is towards the linea semilunaris. That is the lateral margin of the rectus sheath. Just a minute, it will take some more time to clean. Lot of adhesions I am just facing here of the muscle. They are directly taking origin from the undersurface of the rectus sheath, which is quite unusual. This is the second tendinous intersection. Just this muscle. With the finger I will try to get the medial border of this muscle, and this is that lateral border here. See this lateral border? So it is quite broad above. As we go below, it becomes narrow. See this muscle. See this, it is very strong muscle. This is the first tendinous intersection. This is the level of the xiphoid process. The seventh costal cartilage I can feel here. So this is the level of the xiphoid process, and it was cut during the dissection of thorax. And this is a pyramidalis small muscle, very small pyramidalis muscle lying anterior to the lower end of the rectus abdominis. Now the origin of the rectus abdominis is from the pubic symphysis, anterior aspect of pubic symphysis, as well as it takes origin from that of the pubic crest right up to the pubic tubercle. Okay, so pubic crest, pubic tubercle, and then up to the this pubic symphysis. Yes, you can see this first tendinous intersection. See this? Here is the first tendinous intersection. This is the second tendinous intersection here, where I have just cut this muscle, and this is the third, which is not very clearly seen, but there is a third tendinous intersection. The fibrous tissue are intersecting the muscle fibers and attach onto the undersurface of this anterior layer of this rectus sheath. Okay, so this is the rectus abdominis. Its insertion is onto the by a horizontal line onto the fifth, sixth, and seventh costal cartilage and to the xiphoid process. So that is the insertion. Origin is below and insertion is above, and whole of the length of this muscle is enclosed by the sheath, which are the rectus sheath, which are nothing but the tendons of the insertion of these three abdomen muscle: external, internal, and transversus abdominis muscle. Now, after seeing this muscle, what I am going to do is that I am going to cut this muscle here and will reflect upward and downward. Okay, so that, but these tendinous intersections are not there on the posterior surface. Okay, so it will be easy to reflect this muscle. I am cutting this muscle from the middle of the somewhere middle, not exactly in the middle, somewhere in the middle. One can cut this muscle and reflect it upward and downward, so that the lower portion of this muscle will go downward. One has to be careful because an artery is coming from below, and that is the inferior epigastric artery, branch from the external iliac. It is branch, inferior epigastric artery, branch of the external iliac artery. Okay, so I am just trying to lift this muscle from below and then going upward. So this is that artery, inferior epigastric artery, and we'll lift it here. Yes, I am trying to separate the blood vessels and the nerves which are lying deep to it, completely separating, and then I will lift this muscle. Okay, and will reflect it downward. So lower part will be reflected downwards, and then we will be able to see the inferior epigastric artery. Let me do it. This is fused. Old man, a lot of fusions are seen here. So I am removing the adhesions of this muscle, and then we'll remove this. See this, I am reflecting it downward. Just I have reflected this muscle downward, and this muscle here, this fascia which is seen is fascia transversalis, and this is that inferior epigastric artery. You can see this artery here. This is an inferior epigastric artery along with the inferior epigastric vein. This is the posterior layer of the rectus sheath. Posterior layer of the rectus sheath is seen. Now similarly I will try to just reflect the upper half of this rectus abdominis muscle. This strong rectus abdominis muscle upward. There is no adhesion to the posterior wall. Okay, so I will just reflect it, and there we should get another artery which comes from above, and that artery is called as the superior epigastric artery, which is a branch of the internal mammary artery. Branch of internal mammary artery. Just a minute. Now these two arteries, superior epigastric, which comes from thorax, internal mammary branch, and that of the inferior epigastric, they anastomose with one another. And you can see that lot of the nerves, see these intercostal nerves are seen. You can see this 1, 2, 3, and there will be the fourth intercostal nerve along with the anti-intercostal artery. See these nerves, they are going deep, they are going. I hope that you are seeing this now, which are coming from deeper layer, means the posterior layer of the rectus sheath, and then they are piercing this muscle, and then they will come out and pierce the anterior layer of this rectus sheath to lie onto the skin, to supply the skin. So many. These are the anterior ends of the intercostal nerve. See this nerve, this nerve, this. Okay, intercostal nerve and the intercostal arteries. Okay, terminal end of the intercostal arteries are here. Okay, I am trying to find out where is that artery. Okay, that is called as the internal, I would say superior epigastric artery. Okay, and I am not finding the superior epigastric artery anywhere. Okay, bye. The superior epigastric artery runs down below here on the posterior surface of it, and will anastomose here with that of this inferior epigastric artery, which is lying here. Okay, the nerves will be also here lower down, subcostal will be also there, and then these nerves and vessels, they will go anteriorly. But I am trying to find out the superior epigastric artery, which comes after piercing the intercostal space into the sheath. Okay, and sheath is here, that means it should be somewhere here. Yes, probably this, you can see here. See this is the seventh costal cartilage. Okay, that means the lowest costal margin is here, and this artery which is coming here, this artery by margin of the costal cartilage here should be the internal superior epigastric artery, because I am not getting any other artery lying here in this space. So probably this is the superior epigastric, or representing the superior epigastric artery here. Okay, seems to be intercostal artery mostly, but then yes, I am not finding anywhere in this sheath. Okay, this sheath, let us see on the posterior surface if it is lying there. In the posterior surface, no, there is no artery. There is no artery here on the posterior surface of the rectus abdominis muscle. Okay, I could not show you the superior epigastric. Probably it may be the superior as it is coming from the lower margin, but mostly it seems to be a artery which is intercostal. And then this you have seen clearly about the inferior epigastric artery. This is the posterior layer of the rectus sheath which encloses this muscle. Now the muscle is supplied by the lower 6 intercostal nerve, including the subcostal, lower 6 or 5 intercostal and subcostal, this rectus abdominis. This is muscle which is a strong flexor of the abdomen. This muscle is a strong flexor of the abdomen. Okay, and then other action will be that it holds the abdominal viscera. This is the muscles which just also restrict the distension of the abdomen, okay, distension of the abdomen. But its most important action is that just to raise the intra-abdominal pressure also, and to hold the intra-abdominal viscera inside. So this is the rectus abdominis and this pyramidalis muscle, which is a vestigial muscle, this pyramidal shape, which goes and gets attached onto the linea alba, which is the midline fibrous band from gyphoid process to the pubic symphysis, and its contraction tightens this linea alba. It tightens the linea alba. I think this completes the dissection of the rectus abdominis muscle. In the next video, I will show you the formation of the rectus abdominis and its relation of the rectus sheath. Okay, relation of the rectus sheath. Thank you very much for watching this video.